All right. Okay, that's a very technical question that you ask. So, all right, we're going to talk about that. Now, UAE stands for Uterine Artery Embolisation. It is not a new procedure. It's a procedure been around for a long time. We use the same procedure to save woman's life after a postpartum hemorrhage, right? And also, it's been used to treat uterine fibroid for more than 25 years. Okay, it works on the concept that tissue cannot live without blood supply. If you shut down the blood supply, tissue will die, right? For example, I'm going to show you some fibroid cases here. As you can see, this is a huge fibroid. That itself is 500 ml. After embolization, you can see the fibroid becomes dark on MRI. That means it's not active anymore. It's not only smaller, it's not active anymore, right? We treat, doesn't matter the woman had 1 fibroid or 20 fibroid, they all treated in one go, and because we're not targeting each individual fibroid. So as you can see, the fibroids all get treated in one go, they get shrunken. Now, the concept of using the same method to treat adenomyosis has been around since the early 2000s. So it's almost 20 years as well. Okay, it's the same procedure as I say. It's an angiographic procedure. It's done by interventional radiologists. It's not surgery. So we only make a tiny nick or small cut in the groin. That's typically about 3 millimeters. And then that will allow us to insert a catheter, which is a small tube, which is the size of the silver of the ball pen. And using X-ray mapping, what we call angiogram, so we create the map of the artery, and then we can follow the map to find the left and the right uterine artery. So once we're there, what do? We inject particles into the uterine artery, right? So the particles is going to go in to block the blood supply, to reduce the blood supply. And the abnormal part, which is the adenomyosis, or sometimes fibroid as well, and they will shrink and die without oxygen, without blood supply. Easy to understand. The key question is, how come the normal part of the uterus is not harmed? Okay, we can show you examples that these are all the cases of adenomyosis that we treated. Okay, so as you can see, this is a case of a focal adenomyosis. After treatment, it becomes dark, right? And this is a diffuse thickening of the junctional zone on the MRI, and you can see it's almost normal looking uterus afterwards. So they either become scar tissue or the abnormal tissue kind of disappear. Now, the normal uterus remains quite normal. In fact, this lady got pregnant twice with full-term baby after UAE. So, and again, go back to the question, why the abnormal tissue die or disappear, and yet the normal part of the uterus is not harmed? This is because the normal part of the uterus has enormous number of underlying dormant collateral vessels. And these vessels are recruited during pregnancy. At childbirth, these vessels shut down and they are not flowing anymore. And they're there, they're dormant, they're ready to be recruited for the next pregnancy. So during the procedure, as you can see, some particles might end up in the normal part of the uterus, but that's not going to harm the uterus, as you can see so many examples, right? The fibroid's dead, adenomyosis dead, adenomyosis disappear, and yet the normal part of the uterus is not harmed. Women can still get pregnant. That is because the normal part of the uterus can recruit these vessels to keep itself alive. And of course, the uterus is not going to like it initially, and that's why we need to keep the patient overnight for pain control. The lack of oxygen can cause crampy pain, like a severe period pain, and that the woman might experience. But the next morning, typically these vessels started to open up, and the pain will ease, and the patient can go home.